All right, hi everybody. I'm here to talk about telemedicine. The last couple times I made this, I took too long talking, so I'm going to try to keep it short. But if you know me at all, you know that doesn't really work too well typically. So anyone who's a patient, please listen to the second half of this. You can just probably fast forward ahead. And but for the medical professionals, here's a couple things you should know. If you're not aware already, virtual visits are going to become the norm. They will be the majority of patient visits, certainly within the next 10 years. And it may even be more aggressive than that. I've seen as recently as 2024, as early as 2024. I think that might be a bit aggressive, but we know it's coming. Unfortunately, parity is not national yet, but so it's very tricky to navigate these waters. But if you don't have a strategy right now, how to integrate this into your practice, you are certainly behind the curve because your peers are already at least putting in a strategy, if not already implementing the simpler pieces of this. So, you know, there's lots of difficulties figuring out which payers accept it. Generally speaking, some of the national payers are really kind of just pushing it through. But even so, what are they accepting? What are they allowing virtual physical exams? Are they allowing virtual psychotherapy? You know, sometimes a payer will cover everything, but it depends on the individual's member benefits. What are they actually eligible for? What's part of their plan? So it's very difficult to navigate these waters, but also how are there ways that we can integrate this into your practice so it can save you money? So, you know, how do you collect the copays? You know, you have to create a portal that forces a patient to pay the copay, swipe a credit card before they actually get into the virtual waiting room. What if you have something like right now you have unprofitable evening hours? How are you going to be able to make that profitable? With telemedicine, you can have a provider on call, and you can just have an RN or an MA that's in the actual clinic, and patients who can be seen virtually you can just have someone on call so that they can see patients with straightforward needs, or even sometimes with physical exams. You have to understand what is accepted and what isn't. And there's lots of rules, of course, that go for that. So there's ways to make certain pieces of your model right now that might not be profitable, or give you options that you didn't really think were going to work out. Even, you know, I have a client right now that is looking to open 2 locations and put, you know, 5 clinicians in one, 3 clinicians in another one. Now, my advice is, because it's very difficult to run 2 locations versus 1, you can keep them all into one house if you properly strategize where, you know, if you have some of them doing calls, some of these doctors can do this straightforward subsequent visits out of the comfort of their own home, and you save exam rooms. You don't have to pay any more overhead for any extra employees, and now you can actually staff up with more clinicians. And there's ways to create these models that are predictable and can really improve your reimbursement. So that's from the clinical side. So if you haven't created a strategy or want to, certainly my team can assist with that. And then for the patient side of things, you know, it's frustrating. I know that we have at least Massachusetts lobbyists, Rhode Island lobbyists, and DC lobbyists that will watch this video. Hopefully others as well. But, you know, there's a need to really advocate for telehealth, because I mean, I can tell you from a personal side, there's a member of my family who had recently passed away last year, and she was quite elderly and had to go into the office for something that was certainly a very routine visit, not something that I would think certainly would constitute a need to come to the physical office. And when her husband came to pick her up, she took a bad step off of a curb and broke her hip, and 8 weeks later, unfortunately, she had passed. So could this have been prevented with telemedicine? You have people who are agoraphobic, that aren't comfortable in social situations, have a lot of social anxiety. You have people who have transportation issues because whether they're elderly or they have hearing or vision difficulties, that virtual visits are just kind of automatic. Even on something that might be more mainstream, in the sense that you could have, let's say, a single mother with 2 kids. She needs to go to work and drop the kids off at school, and all of a sudden one of the kids gets like a cut on their arm. She's not sure if it's infected or not, how she should probably treat it. Now she might need to use PTO for take a whole day off. Both of her kids might now need to miss school for a day because she has to take them into the doctor's office. Now instead you have a virtual visit. The doctor can see the injury on the arm, can prescribe meds, send it right over to your local pharmacy, and now you're just driving to school, picking up the meds on the way, dropping both kids off at school. You get to go to work. I mean, even from a more practical standpoint too, sometimes you have those 5-minute follow-up visits. You know it's going to be a joke. They're looking over basic things like your, lab results or something like that. Or maybe it's a 5 or 10-minute talk. You could do this on your break at work. You could go into your car, open up your phone, go into the portal, pay with your credit card for your copay, and now you've done it in your 15-minute break that you have at work. You've taken care of the whole visit, and you didn't have to miss half of a day and lose your PTO time for something silly as 10 minutes of a time with the doctor. So for the patients, things are about to improve. For doctors, it improves things financially. The trick is to just get ahead of it, find out where everything is right now in your local area, and get ahead of the game. And for the love of God, lobbyists, please keep pushing the lawmakers to make sure that parity is national, so that this can make healthcare much easier for everybody and prevent tragedies from happening. I mean, this technology, it's been around for a while. Let's make it mainstream and as quickly as possible.